Good afternoon. We'll get started now. My name is Tammy Ford, and thank you for joining me in the Blunt Partnership as we try to bring you timely information every few days. And so today, there's a lot of things going around, a lot of information, and so what we're trying to do is do tidbits of information for folks to understand and digest and be able to ask questions. So after our session today, we're going to have a chat feature. So please feel free to enter your questions or comments in chat, and we'll reread those. And Howard and Ed Trent could answer those questions. Followed by that, at the end of the session today, we'll do a poll. And then if throughout the presentation, if you think of topics you would like us to see us do, please feel free to send those over to me, and we'll see what we can do about doing that. First of all, I wanted to thank Howard Jackson and Ed Trent for taking their time to do this. I appreciate y'all very much. Wimberly Lawson has always been really good, a great chamber partner, and today is no different. So Howard, Ed, I assume you're going to solve the mysteries and all the things that are going on in the workplace. All the people in the workplace trying to figure out what to do and what not to do. So I'm going to turn it over to you for like a 10 or 15 minute presentation, and then we'll open it up for chat. So thank you.
Well, we appreciate the opportunity. We've always loved working with you guys. And there's obviously just so much going on right now. We're going to take a buzz through several of these laws and do a bit of an overview and maybe point out some things that are really good to be aware of. And then we'll look forward to talking about what's on everybody else's mind. Kind of in the big picture of things, it's important to be calm as you can, to communicate well among your management team and with your employees, because that goes a long way towards helping folks get through, all of the changes that are being thrown at people. There's legal changes and there's operational challenges and changes. And so, it's always good to remember, just even at the beginning, that these are all things that you can sort through and deal with. Take a deep breath, take your time, talk it through, reach out to the resources that you have, be they at the chamber, with your labor council, and even with other things. I know the chamber is going to do a presentation relative to the payroll loan program, all those things. You got resources that can help you with. And so we're going to try to do our part today. I really appreciate Ed taking the time to be here with me. And he's going to talk to you a little bit about the Family First Coronavirus Response Act.
So you all have probably heard an awful lot about the Families First Coronavirus Response Act, the FFCRA. It's going to be one of, unfortunately, several acronyms or alphabet soup. So if you think you're in an acronym horror show, you might be, but it's important to kind of keep how some of these things work together. There are really two key aspects to the FFCRA, and it will apply to all employers of less than 500 employees, as well as to most public employers. So if you fall within that category, then you need to be aware of how the statute works. There are two primary aspects to the FFCRA, the first of which is the emergency paid sick leave portion. It provides for up to 2 weeks of paid sick leave, a cap of 80 hours for sick leave related to one of the 6 reasons set out in the statute. So for your full-time employees or employees working at least 40 hours a week, they will get a total of 80 hours of paid sick time under the statute. This is in addition to anything that you as the employer already provide to them. So they can use the FFCRA benefit first, and then they still have all of the benefits provided under your employer plan and policies. So remember, this is in addition to anything you provide. Paid sick leave is related first if the employee is subject to a federal, state, or local quarantine or isolation order, so they cannot come to work, they would be eligible to use their paid sick leave benefits. if they've been advised by a healthcare provider to self-quarantine related to COVID-19. And we'll talk about what that can cover in just a moment. Or if they're experiencing COVID-19 symptoms and are seeking medical care, they can use their paid sick leave benefits. And they would get their full regular rate of pay for up to 80 hours of sick leave for those particular reasons. You'll notice that none of these require the employee to actually be diagnosed with a COVID-19 diagnosis, but rather they're subject to quarantine either by a doctor or governmental agency, or because they have the cough and a fever, or a fever and respiratory issues, symptoms similar with COVID-19. It's not going to cover someone who has a symptom of a broken ankle because they were playing basketball with their child in the driveway because they were staying home from work. That's not going to be covered. But they'll get their full regular rate of pay for up to 80 hours. Again, but that is capped at $511 a day, or a total of $5,110 for the 2 weeks. And that's also the amount you can claim a tax credit for against the payroll tax. If the employee needs to be out because there is another individual subject to either the governmental quarantine order or a doctor's quarantine order, they also get to use paid sick leave. If they need to be home to care for a child because the child's school or their child care either facility or the person providing child care is not available because of COVID-19, they also get to use paid sick leave. Or if they have symptoms of a similarly situated condition identified by HHS, of which right now we've not seen any of those, they would also get leave. But under these last three, those 80 hours maximum would be at 2/3 their regular rate. So not the full rate on these, but it's a maximum of 2/3, capped at $200 a day for the care for somebody else reasons. So those are going to be available to them. Part to know is, particularly people have been asking a lot of questions, is, well, what could a doctor keep them out for that's COVID-19 related? It could be that they've been exposed to someone, but they're asymptomatic and they should self-quarantine. It could be that they do have symptoms themselves and need to quarantine. Or they may be at high risk and the doctor says, because of your risk factors in your work environment, we think you need to quarantine. But you need to know that it is from the doctor. And the employee would need to provide you the name of the doctor or the governmental agency that issued the quarantine order in order for you to be able to process it. You can collect documents that you would need in order to collect the tax credit and have that on file. If it comes down to the child care absence because school is closed, you can ask for the name of the child, the name of the school or the child care provider, and a representation that somebody else is unavailable to take care of the child. So if their grandparents are still able to take care of the children during this instance, then the employee doesn't need time off for that. And that's set out on some new regulations or draft regulations that came out yesterday. And again, there's the tax credit on the payroll taxes that you do at the end of the quarter. And it's dollar for dollar on those wages paid for under the FFCRA. The second part of this is an expansion of the FMLA statute. And it again covers all employers with less than 500 employees. So our employers with less than 50 employees who have never been subject to the FMLA will be subject now, but solely for the reason that the employee must be absent because of childcare issues due to school closings or childcare unavailability related to COVID-19. That is the only new reason that is in this new statute. And it provides for up to 12 weeks of FMLA that counts as part of that same 12-week of FMLA bucket that our employers of 50 or more are used to, and they can use it for that particular reason. Again, they would need to provide the same amount of information that it's indeed their son or daughter, or they stand in loco parentis, that the school is closed, and what is that school closing, and again, that somebody else is not available to take care of them. When they begin that FMLA leave for the child, the first 2 weeks is unpaid under the FMLA, but they are able to use either their emergency paid sick leave benefits under the FFCRA, or they can use employer provided paid time off to cover those first 2 weeks. And that may be the case that they will do. Remember, the FFCRA benefit is still at 2/3 their regular rate, whereas the employer provided benefit, PTO time, or other kind of leave that may cover this kind of an absence may be at their full rates. After those first 2 weeks, up to the balance of the 10 remaining weeks of FMLA, then they are required to be paid at 2/3 their regular rate. Again, you can claim a tax credit against your payroll tax obligation for that 2/3 rate, but then they would still, though, be able to get that, and it is above any employer-provided paid time off. So it's important to remember that. If you are subject to the FMLA and the employee has already taken FMLA earlier in the year, say they were out for 4 weeks in January for some surgery they had, then they've only got 8 total weeks left of FMLA during this time period. So the first 2 weeks would be unpaid, subject again to them substituting some other form of paid leave. And then the last 6 weeks would be subject to that 2/3 rate to bring them to a total of 12 weeks of FMLA coverage. For employers with less than 50 employees, they're going to use the full 12 weeks. There are 2 exceptions to this statute. The first is for healthcare providers and emergency responders. So our employers who employ healthcare providers or emergency responders can be exempt from the statute in providing these various benefits. It is an election made by the employer. It can either cover all employees, for example, at a doctor's office, including those necessary to keep the office running, or you can decide that certain of those employees by category are necessary and they're going to be exempt from the FFCRA benefits, but we're going to allow, say, clerical staff to use those benefits, in which case they will get the same benefits under the statute. The other are for small employers of under 50 employees, and the Department of Labor has put out some initial guidance on how those small employers who believe that if they were to provide these benefits would ultimately go out of business, could be able to exempt themselves. An authorized representative would have to make certain findings under the statute related to the provision of benefits in order to claim the exemption. And you would certainly want that to be, has to be in writing, and you will need to be able to keep it to the extent Department of Labor audits. Department of Labor has not given a guidance yet on how to claim it through the Department of Labor, but they do allow small business to claim the exemption if providing the benefits would put them out of business, or by allowing people to use the leave, they would be unable to stay open because either they don't have enough employees or certain employees with specialized knowledge would be unavailable, so they couldn't keep the doors open. Again, it's a fluid situation, and we'll see where that goes. But those are the primary benefits, and to continue to follow guidance as it comes available.
Under the Family and Medical Leave Act, of course, Ed just covered the majority of how that's impacted by the expanded leave. And I think it's worth repeating that the expanded leave under Family and Medical Leave Act applies in only one case, and that is where the employee loses their child care. That's the only category where the expanded leave applies. None of the others apply. Now, all of the other typical FMLA rules and entitlements that apply to employers of 50 and up are still in place. And so you want to remember, for example, for the majority of people who may come down with this virus, it's not going to necessarily be an FMLA situation. They're going to get leave, maybe temporarily because they got a quarantine, but it may be that they don't need anything beyond that because their symptoms don't prevent them from working. But for some people who have a more difficult case, it may be that you'll get an FMLA certification in based on the virus itself, because it may hit this individual harder and keep them out of work for a more significant period of time. And so it is certainly possible that people who are diagnosed will need to use FMLA. And if you get a medical certification for that, we'd honor it just as in the past. And then again, as Ed mentioned, you want to track your FMLA use appropriately because it does not stack. In other words, an employee gets 12 weeks, and if they qualified for some other reason, either later or in the future, they had an accident at home or what have you, and they take a couple of weeks, that counts towards the 12 weeks. And the expanded FMLA is not on top of that, it's still a total of 12 weeks. So I'm going to move on from that for the moment. The Fair Labor Standards Act kind of comes into play in a variety of ways on the situations that our employers are facing. For example, if you decide that you're going to reduce work schedules, what about reducing pay? Well, if you've got a non-exempt employee, commonly called an hourly employee, you have a lot of freedom to reduce their pay. You can't reduce it below minimum wage, of course. And if they work overtime, they have to be paid the overtime rate. But it's relatively easy for, say you've got a group of employees that make $12 an hour, $15 an hour, and you call them together and say, listen, in order that we don't lay anybody off, what we're going to do is we're going to reduce the pay of you all in this $15 an hour group to $12 an hour, and we're going to work 35 hours a week instead of 40, but we're going to keep everybody on the job. You can do that with non-exempt employees or hourly employees. If you have salaried employees, it's a little more complicated. The general rule for a salaried employee and exempt salaried employee is that they have to be paid their weekly salary for every week in which they do any work. And so if they come in and work a day, the general rule is they get their salary for that week. There's some exceptions that is probably more than we can go into now, but if somebody wants to ask that question later, we can address it. But one thing you can do with salaried people is you can change the salary, but you got to be a little bit careful there, because if you change the salary every month, the Department of Labor is going to take a position that you're not really paying a salary. But it is possible to say, okay, we're going to, for our salaried workforce, starting on May 1st, we're going to have a 20% pay reduction, and that's going to, for the time being, that's going to be in force for the next 90 days, and we're going to revisit where we are then. So you can change it to some degree for a substantial period of time, but if you just play with it week in, week out, month in, month out, you risk losing the exemption. You may say you're really not paying on a salary basis. So you want to plan carefully and understand the rules of the road if you're going to take actions that impact people's pay. The Americans with Disabilities Act comes into play, and all the usual rules remain. Most of the time, if an employee is diagnosed with this condition, or even a family member is diagnosed with the condition, it's not going to be a disability because it's a transitory condition. And so you don't have to do an ADA accommodation, so to speak, for somebody that has the condition. That being said, we certainly are encouraging, as are the EEOC and the Department of Labor, employers to work out flexible arrangements to every extent that they can to try to work with employees. Anxiety about becoming sick would not get somebody to the level of requiring an accommodation. Again, we are just simply encouraging people to make the most logical and reasonable arrangements that they can with employees who are reacting with fear or concern about exposure, and to take all the precautions that they can and handle it that way rather than treating it more formally under this law. Here's a law that I hope none of you ever have to worry about. It's a federal law, the Worker Adjustment and Retraining Notification Act, affectionately known as the WARN Act. And in that law, you have to have 100 employees for it to come into play. And then if you are going to have a permanent or temporary shutdown of a site of employment that affects at least 50 employees, or if you're going to have a mass layoff of at least 500 or a minimum of 50 that equals 1/3 of the workforce, then you have to send a 60-day notice to the local and state government, as well as to the union if you happen to be organized. So there are some triggering numbers there. Again, you have to have at least 100 employees, be that large of an employer to start with. And then you have to have job loss of 6 months or more based on a shutdown of 50 employees, or if it's a layoff, either 500 employees or at least 50 and 1/3 of the workforce. And there are unforeseeable business circumstance exceptions. So if somebody experienced such a mess at the very beginning or very near the beginning of this pandemic, I think an example might be Cheesecake Factory that people heard of a lot. They just decided, nobody's allowing us to open our doors, and they laid off, what was it, 41,000 people. They could claim an unforeseeable business circumstance there. But I think the longer that the situation drags on and people stay in business and continue, the harder it is going to be to claim that exception. So there's a quick and dirty on that. And so now we're going to stop with our just talking head and invite you all to send in your questions. Tammy will see them and read them for us, and we'll see what you'd like to talk about.
So while we're waiting on some questions, we did have some difficulty. There were some folks that didn't make it in early. We're trying to figure out why. That if you did make it in, but you came in late because of some technology difficulties, let us know. And we're happy to send this out. Howard, are you okay for us distributing the recording today?
Sure.
Okay. So if everybody would like one, that a copy of this recording, we will send it out. Or if you came in late, we're happy to provide that. So question time. So I take it that everybody knows everything they need to know.
Maybe we threw so much out there that it's hard to formulate a question yet. Why don't we go ahead and talk a little bit about there was a set of regulations that came out yesterday that clarified a few things that were not necessarily so clear before. And I'll throw out a couple of those. One is, under the Emergency Paid Sick Leave Act, they set out a number of factors that allowed somebody to take leave, including if the employee was out because they may have COVID-19 and they're seeking a diagnosis. One that wasn't necessarily clear earlier is that, some folks have these comorbidities. They have asthma, they have a heart condition, they have something that makes their immune system weaker. Suppose they don't have it, they don't have symptoms of it, but their physician gives them a note that advises them to stay away from work or to be quarantined and stay away from work. Are they allowed to take this leave? And the answer came out in the regulations that if you got a doctor's note that says the employee is particularly vulnerable and the order to self-quarantine prevents the employee from working either at the regular place or teleworking, then they would qualify. So if somebody's not sick, but the doctor says you need to self-quarantine, if they can telework, if you can provide them a way to telework, or if you can provide them enough isolation at work, they may still be allowed to work. But if you can't do that, then you need to allow them this time away under the paid sick leave. I think I saw a question or two.
Yeah, you've got a few here, so I'll just start at the beginning. The question is, if I'm understanding this, they need a doctor's note or an order for it to be a valid COVID-19 leave of absence. Is that right, Howard?
They definitely need a directive from the doctor. You can either have a written doctor's note or they can verbally provide that to you with the name of the doctor. The regulations ask employers to be somewhat flexible in that regard, simply because getting a written doctor's note may be difficult if the doctor's office is overrun. But if the employee wants to get it, getting something from the doctor's office obviously is preferable, and certainly checking with any tax preparer if they need it in writing in order to claim the tax credit, then you may absolutely request a written doctor's note.
But at the beginning, if the employee calls you and says, I had a telemedicine visit with Dr. Jones of the Blue Cross or whatever telemedicine program yesterday, and she checked my symptoms and told me to stay away from work, you can say, all right, email me that, or make a note of it in the beginning, and then you can get the more formal documentation together later to make sure for the tax credit. So you don't necessarily have to have, it's good if you can, but it's not required to have a physical doctor note in hand at the very beginning of the leave.
Thank you. And this, you may have answered this, but I'm going to re-ask it. Can benefits be included in the tax credit? Is that what you were just talking about?
Yes. Under both the expanded FMLA and the Emergency Paid Sick Leave Act, the law is that the employer receives a dollar for dollar credit against the payroll tax that's due at the end of the quarter. And then there's, as Ed mentioned, there are limits on how much anybody can collect. But let's just, for example, if you had 2 employees that took the leave and you spent collectively $4,000 paying them, then you would get a $4,000 credit against your payroll tax due for that quarter.
Yeah, and it's the wages that are paid for the paid leave or under either of the 2 statutes. So it's the amount paid in wages required by the statute. Any other benefits provided by the employer associated with that, we don't read that as being part of the tax credit.
And I think this answers this question, but I'll ask it because it was posed. How does an employer actually take tax credit on the payroll tax and the paid sick leave, or the paid sick leave paid?
I haven't seen a form for that yet.
There should be, that's really a good question to ask whoever prepares their quarterly tax payroll tax statement. There should be a way on there to simply identify the amount of wages taken and apply it towards the tax liability. The law also says if the tax liability or the amount of wages paid on the FFCRA benefits exceeds the tax liability, then the excess amount paid in wages will be treated as an overpayment and reimbursed. But again, that should be a way to do that on the actual form that is submitted while retaining the necessary documentation in the event of an audit afterwards. But that's really kind of a tax question to ask whoever prepares those documents.
Okay. What about employers requesting notes when our medical facilities are already stretched so thin? I know CDC has recommendations about this, but people do not seem to be abiding by that.
Well, that goes into the, as Ed sort of mentioned earlier, that all of the agencies that are involved in administering these laws are encouraging employers to be more flexible than usual, because sometimes it's just doggone near impossible to get a note, or at least to get a note quickly. So if somebody is exhibiting the symptoms and they describe those to you, they call their doctor office, they have a telemedicine visit, that you would want to accept those kind of representations now, more so than you would under normal circumstances.
And as Howard mentioned, getting a verbal reference that you can document, and then if you want to follow up later when maybe the doctor's offices aren't as overwhelmed, that might be the time to try and follow up on written documentation if it turns out that that's necessary. But you certainly don't need a written note prior to granting the leave based on the employee's representations.
Okay, next question. Can employees use the emergency sick leave before April 1st? Example, if an employee started leave last week due to lack of childcare and is out again this week, can the emergency sick leave be utilized for these 80 hours?
No, the law took effect April 1st. And so any time away before April 1st doesn't count, so to speak, against the entitlement. And, you know, it's certainly good that even before then, employers are working with people as best they can. But it took effect April 1st, and it only applies to leave taken after April 1st.
Okay. Oh, is there a printout of the meeting today? And I missed most of it due to technical difficulties, and I don't truly understand the credit and how to apply. So maybe if you could address the credit part briefly, and then Sharon, yes, I will send the whole presentation out to everyone after today's meeting.
Yes, as we mentioned just a little bit ago, the credit amount, according to the statute, it's dollar for dollar related to the wages paid as either the emergency paid sick leave or as part of the extended Family Medical Leave Act. There are caps under the statute in terms of the benefit, but everything paid under the statute as the additional benefit is credited on the payroll taxes. And I would work directly with whoever prepares those payroll tax forms on the best way to claim the credit, or if there's an overpayment, how to claim the reimbursement. But those additional guidance is coming out, and the Department of Labor has provided some links to the IRS on how to claim and apply those credits. But that's really more of a tax question.
Next question. What if you have a multifamily situation where the grandparent is your employee and they find themselves being responsible for grandchildren that are in their household? How should that be dealt with from a legal perspective? And the second part of that question is when the actual parents are in the household as well.
Well, in that case, it's really for the child of the parent. And so if the parents are in the house as well, I don't think the grandparent is going to qualify as the in loco parentis kind of standard. And what we mean by that is, there's some situations, for example, the wife in the house, her sister has an illness or whatever the tragic thing is, and she takes in her sister's children. She and her husband do. And she and her husband, although not formally adopting perhaps, are in essence the parents. They're doing everything that a parent does. In that situation, although the child is not biologically her child, if she loses child care, she would qualify under that in loco parentis sort of standard. But if you got, a grandparent that happens to be allowing their children and their grandchildren to be in the house, I don't really think that's likely to qualify. Do you want to add something to that?
No, and again, that's going to be a fact-specific type situation. The definition of child is fairly broad under the new regulations, but there is a requirement in these draft regs that came out yesterday that the employee who wants time off to care for the child needs to represent that someone else is not available to care for the child. So that absent the employee taking time off, the child would be uncared for. And if the children live in the home or the actual parents of the child and they're able to care for them, then the grandparent employee doesn't need or qualify for time off under the statute.
Good question.
Yes.
Next question, when does the paid sick leave take effect? We have an employee that has been quarantined since March 25th.
Takes effect April 1st. So that employee would be eligible for the paid sick leave 80-hour benefit starting on April 1st, starting yesterday.
Next question is, from what I understand, health insurance is also a credit that can be refunded to the employer. Is that correct?
I'm not aware of that under the FFCRA, but again, I would check with a tax professional on what credits that you can obtain. There might have been something in the CARES Act, which was passed last Friday, that may expand some various tax credits, but again, that would be more of a tax question than an employment law one that we're able to answer.
Yeah, I believe the Paycheck Protection Loan allows for, I'm pretty sure it does, allows for more than just wages. I know it does. I'm not sure of all the categories, but that would be the SBA loan administration, not something that's not provided for under the FFCRA.
Here's a question. If someone left work as of March 18th because they were high risk as well as their families, they told their employer and the employer wants them to come back when this passes. Unemployment has already been approved, but what about health insurance? Should FMLA also be filed?
In that situation, if the employee is not actually ill, they would not get family medical leave. They would qualify with an appropriate doctor statement, they would qualify for the emergency paid sick leave, 80 hours. But if they're not actually sick themselves, such as they're unable to work, I don't think they're going to get FMLA. And so you would want to follow whatever your normal practice is for people on unpaid leave in terms of giving them a COBRA notice.
If an employee qualifies for FMLA, extended leave due to childcare reasons, and receives the 2/3 pay benefit, can an employer prohibit them from utilizing their other forms of leave to make up the pay difference?
No, I think that's the employer can allow that if they want. I don't think it's required to do that. But if the employee wants to say, I'm getting 2/3, I'll probably be out a month, and I'd rather use, I've got a leave bank of 160 hours. I'd like to use 100 hours of that to make up my pay. You can permit that, but you don't have to allow it.
And this may be getting close to our final question. If an employee has a second job that increases exposure to COVID-19, such as a retail position, do we have any oversight, considering we are the primary position? Do we have any oversight, considering we're the primary position? And then coworkers of these employees are worried about working closely with these individuals. Do you have any suggestions about how to handle this situation? Unfortunately, teleworking is not an option.
Right. If you have a reasonable concern about exposure, you can tell somebody not to come to work if you want to. You can also explore other arrangements like physical distancing at work, whether there are ways to limit contact among that person and others. So I'd encourage you to get creative about that. But at the end of the day, if you want to say, look, you're working at a place that gives you higher risk of exposure, and we're going to protect our workplace by telling you, don't come back until all this passes, or either leave that job, that's an option that's available to you.
Thank you, Howard. Oh, another question. Does the current Safer at Home order by Governor Lee apply to the Families First qualifying reason 1? Or do we need to be in a shelter in place order to qualify for reason 1?
There's not a real clear guidance on that. The question would be is if there is information in the FFCRA that says if the employer closes operations, or lays off folks or reduces hours because of a statewide order, and the employee is at home not because of an order specifically related to them, but because the employer changed their hours. And if the employer puts them off work for a period of time because they've decreased hours of operation, that does not qualify for the benefits. If people want to use that as an opportunity, says, hey, it applies in my particular area, particularly on a local order, and acknowledge it, I just think there's still some ambiguity left with regard to whether or not that's going to qualify for benefits. If the employer is going to use it to qualify for benefits, I would certainly keep a copy because you're going to want to claim the tax credit. And again, I would verify with our tax professionals as to, hey, I want to make sure that these two things work hand in hand.
And just to add to that a little bit, in general, these FFCRA and emergency paid sick leave benefits are intended for employers who are operating and who have individual employees who can't come to work for one of these specified reasons. If there's an order in a locality that says, these businesses just shouldn't operate, so you just stop operating, at that point, the employees are not working and they go to unemployment benefits. They don't get the FFCRA or paid sick leave benefits. Those, as generally speaking, apply to employers who are continuing to operate, but then they have individual employees who can't come for those reasons.
So the question has been posed that what I'm getting ready to ask may be a bigger topic for another meeting, And if so, Howard and Ed, if you all could say so, and we can, maybe that's another opportunity for us to provide information. But can you do just a really quick overview of changes to unemployment?
Well, really quick overview would be that the federal government in the CARES Act has done a couple of things. One is that there's an additional $600 a week for some categories of employees. I'm not sure off the top of my head exactly who all qualifies for that. And then secondly, there's been funds set aside to extend the period of unemployment benefits to 39 weeks. So it's basically from 26 to 39.
Right. They've done two other pieces with that. One is they have provided funds to eliminate the first week of waiting that's under Tennessee statute, provided Tennessee agrees to that. The federal government pays for it. We're waiting for Tennessee to kind of roll out what's there in order to provide the benefits. And then second, employees who may be either exhausted their unemployment or would otherwise not be eligible for unemployment. It may be they work for a nonprofit or religious organization that doesn't pay into unemployment. Those folks would also now be eligible to receive unemployment, provide some for certain self-employed individuals and things of that nature as well. And again, it'll all be administered by the state. They've made forms available, particularly if there are mass layoffs because of the economic hit on so many industries, to upload those all at once to allow to streamline the process of processing and approving unemployment benefits and getting the benefits in the hands of individuals.
And Governor Lee, by executive order a few weeks ago, waived the first week.
Okay.
So that's already been done in Tennessee. Waived that waiting period.
So this may be a topic for further discussion, Howard.
I think so. Once some of the details get ironed out, because that law did leave some of the details of administration and qualification to the states, because states have all, they're all over the place on how they handle these things. And so some of it is going to have to come out in the wash state by state. And when we get more information about what Tennessee's going to do, we could either put out a report or do maybe a shorter webinar on it.
Okay, thank you.
We don't know everything yet.
Another question we have here, what about salaried employees? Can you change the percentage of their amount? If you drop salary by a certain amount, do they qualify?
I don't think it goes by, well, I don't think that would work very well because in Tennessee, at least that is the rule is now. And one of the things that I haven't heard yet is whether the federal subsidy changes this in any way. But the normal rule in Tennessee for partial unemployment is that you have to have your hours or pay cut to the point that it goes below the maximum benefit amount, which is $275 a week. And if you can't cut a salaried employee that low and have them still be salaried. So that's not likely to work. It's a good thought, but the math doesn't work.
So we have another question. One of the reasons says the employee is out to care for, one of the reasons says the employee is out to care for an individual subject to quarantine or isolation order. Can you give us the interpretation of the individual, or can it be anyone?
Well, it says in the regulations that came out yesterday, it says individual means immediate family member, person who regularly resides in the employee's home, or similar person with whom the employee has a relationship that creates an expectation that the employee would care for the person if he or she were quarantined. Individual does not include persons with whom the employee has no personal relationship. So that was in a regulation that came out yesterday. So it's not narrowed to the family member like under usual FMLA, but it's not unlimited. That's what the regulation says. That they reside in the home or a similar person with whom they have a relationship. Like I've known people, for example, that live a couple of blocks away from their elderly aunt or something of that nature. So you just have to make a little bit of a case-by-case determination. Because I met this guy on the road yesterday. That's not it.
I think, I believe I captured all of the questions, but I'll give you another couple of seconds to ask. Ralph Val, thank you for your kind words. Melina Poteet, thank you for your kind words. So this says, according to a posting from the DOL FFCRA, employer paid leave requirements, applicable tax credits also extend to amounts paid or incurred to maintain health insurance coverage. Does this mean that we could receive a tax credit for our portion of health insurance premiums paid for employee and family coverage?
I'm not totally sure on that, but I think what that may be talking about is, for example, you give them the 2/3, and part of that is they pay the employee portion of the health insurance, and you can include that as well in the wages that you know. In other words, if the employee pays $50 to keep their employee only coverage, and that's taken out of the 2/3, you can still claim the whole 2/3. I suspect that may be what that is, but that's probably a better question for your tax advisor.
A couple of seconds will give you a little bit more time to ask any questions while we're waiting on what would be one of our last questions. Immediately following this, we're going to send a poll out, and it's just 2 questions, I think. The other thing is, I did capture that we would like to send this out to those participants today, Howard, if you all are okay with that,
Sure.
as well as our entire membership, if you're okay with that.
Sure.
And then also, I captured that we're going to try to do an overview of unemployment changes, and Howard, you all will work with us on that. And then if you have any other suggestions on topics you need to know more about, please pop those to me. So any other questions? Okay, if not, Howard.
I thought something just popped up.
Oh, another one?
I thought so.
Oh, you may have addressed this. Do employees who have reduced hours qualify for unemployment? And when do salaried employees qualify for unemployment? I may not have been clear in my question earlier or did not understand your response.
Okay. The general rule in Tennessee is that if an employee's pay has been reduced below the level of the maximum benefit, which is $275, then they can get what's called partial unemployment. And there's a form on the DOL website to apply for that under that circumstance. And in fact, employers are supposed to provide information to the Tennessee Department of Labor when that's occurring. But that's because of the requirements for how much salary a person has to be paid. You could never get a salaried person truly be salaried and cut them to that level so that there's partial unemployment. So the real simple answer to when a salaried exempt employee gets unemployment is when they have either been terminated or they've been furloughed. You consider them on leave, but you're not paying them anything at all. And then they can apply for unemployment. But if they're working and getting their salary, by definition, the salary is going to have to be high enough that they would not qualify for unemployment benefits. Hope that helped make it a little more clear. We've got a couple, whenever we're out of other people that have questions, we're happy to address them. There's another point or two that I'll want to go ahead and make whenever it's appropriate.
Go ahead.
One of the things that came out in the leave yesterday, and I think a lot of people had some question about, was what do the employee wants to take this emergency paid sick leave or the expanded FMLA, what notice can an employer require? And the regulations define that pretty specifically. If they're going to take paid sick leave for themselves because of an issue with themselves, they need to give them the date leave is requested, state the qualifying reason, whether it's myself, my illness, I've got symptoms, or it's the name of the government entity has issued an order. You got to provide the name of the government entity. And if you've had a recommendation from the healthcare provider, you got to provide the name of the healthcare provider. So you'd say, my name is John Smith. I want to take leave starting April the 4th because Dr. Jones has told me that I have the symptoms, and so I need to self-quarantine for 14 days. And so that touches all the boxes. And then if somebody wants again, if it's a government entity that issues, then they have to give the name of the government entity that told them to stay at home. Then if they want to get the sick leave under the expanded FMLA, they got to give the name of the child, and then the name of the school or the daycare center, the child care provider, or even the individual name. My mother-in-law, Mrs. Jones, always keeps my daughter, but she has been diagnosed and has to be quarantined for 14 days. So she's unavailable, and my spouse works. And so and if there's nobody else in the house or in the neighborhood that can take care of them. And so that's the information that the employee has to give if they want one of those types of leaves. That's the notice and the information that they have to give you. Okay.
Any other questions? If not, Howard, on behalf of the Blunt Partnership, thank you to you and Ed for taking time out of your day to share your expertise with us. And we look forward to doing this again on a different subject. And we hope the time frame is short when we have to continue doing these, but just use Howard and Wimberly Lawson and use the Blunt Chamber for a go-to resource. So with that, you're getting ready to get a poll, and fill that out real quick. And then if you have specific things that you would like for us to talk about in the future, please email me. Again, I'm Tammy Ford with the Blunt Partnership, tford@bluntpartnership.com. And have a good day.